degree.
Are y'all ready for the Dr. James JC Cooley Show? It's your life. That's right. It's your life with Dr. James JC Cooley. Dr. James JC Cooley. It's the James Cooley Show. It's your life.
The James Cooley Show, It's Your Life, can be heard. The James Cooley Show, It's Your Life, can be heard every Sunday at 9 p.m. right here on The Answer San Diego. Life is full of circles, cycles, phases, and stages. It's your choice to ignore or embrace them. Motivational speaker, author, military veteran, and founder of the J.C. Cooley Foundation, James Cooley, and his guest will inspire and equip you to strive for your own greatness and overcome adversities. Listen to The James Cooley Show, It's Your Life, every Sunday at 9 p.m. right here on The Answer San Diego.
The James Cooley Show, It's Your Life, can be heard every Sunday at 6 p.m. right here on 660 AM The Answer in Dallas-Fort Worth. Life is full of circles, cycles, phases, and stages. It's your choice to ignore them or embrace them. Motivational speaker, author, military veteran, and founder of the J.C. Cooley Foundation, James Cooley, and his guests will inspire and equip you to strive for your own greatness and overcome adversities. Listen to The James Cooley Show, It's Your Life, every Sunday at 6 p.m. right here on 660 AM The Answer in Dallas-Fort Worth.
Yeah. Dr. James JC Cooley. The James Cooley Show. It's your life. Yeah.
Hello, welcome to the James Cooley Show. It's Your Life. I'm your host, Dr. James J.C. Cooley. But hold on. Today is, I tell you what, we're going to hold off on that because I want to lock everything in and get all of the station, radio, television, podcast, everything locked in at the same time. So, Toddy, can we do it?
Oh, it's your life with Dr. James JC Cooley. That's right. It's Dr. James JC Cooley.
Hello. This is the James Cooley Show. You guys got me starting out with my Barry White. So I tell you what, hello, welcome to the James Cooley Show. It's your life, and I tell you what, welcome to the show for one thing. Also, it's Tuesday, 306-degree health. The link is what you think. Just absolutely top-notch doctor. That's right, in the United States of America, all of them, and also the world, is back with us again today, and he has brought an extraordinary guest to talk about a whole lot of things. And I tell you, how you doing today, Dr. Michael Mantell?
Oh, thank you very much, Dr. James J.C. Cooley. Doing well, doing very well. Blessed. Thanksgiving was beautiful. Hope everyone had a wonderful Thanksgiving holiday, and looking forward to having this wonderful guest with us today.
Well, I'm looking forward to it as well. And Thanksgiving, the holidays have just started.
Yeah.
So eating and all that other type of stuff gonna be a problem for a lot of people. But mindset is also gonna be a problem. I mean, we're gonna talk about a whole lot of those things today. How you doing, Dr. Cooley? How are you doing?
I'm doing great, James. How are you?
I am doing extraordinary. And since I see Dr. Michael Mantell and the guest that we got on the show today, and I'm excited about that. Now, let me tell you something. Whichever platform that you're watching us on, whether it's E36 Television, Transfer TV, Apple TV, YouTube, LinkedIn, Twitter, Facebook, Rumble, and over 84 other platforms. Welcome to the show. And if you're listening to us on the radio, that's KCBQ, the answer out of San Diego, K-Sky, AM 660, the answer out of Dallas Fort Worth. Welcome to the show. And if you want to be part of this great conversation that we got with this great guest, all you have to do is just go to the platform that you're watching or listening to us on. And go to the comment, ask any question that you might have. Well, pick up the phone and call my main man Toddy at 1-888-344-1170. Again, that's 1-888-344-1170. So I'm excited, Michelle. Can we get this started? Can you do the honors by introducing the title of the show, purpose of the show, and introduce this absolutely magnificent guest that we got?
Oh, most definitely. So it's 360-degree Health Day, and the title of today's show is called A Loving Organization. And we're having a sit-down conversation with Apurv Gupta, Dr. Apurv Gupta. He's a performance improvement and culture transformation leader. He's going to discuss what a loving organization is, the impacts of a loving organization, and methodologies to help organization. Again, with a background rooted in internal medicine, public health, and health policy from prestigious institutions, including Harvard and Brown, Dr. Gupta, he has successfully bridged frontline clinical expertise with strategic operational leadership. He's renowned for founding the A Loving Organization movement and redefining care delivery through values-based governance. He has consistently improved clinical outcomes, physician engagement, and bottom line results. And he also combines a commitment to equity and compassion with deep operational acumen to help healthcare systems thrive in complex and rapidly changing environments. Please welcome to the show for the very first time, Dr. Apurv Gupta.
Wow. I have never received a welcome like that.
You're on the right show. We love
Oh
having
my
you.
God,
That's the least we can do.
I'm pumped up. That's amazing. That is amazing. I feel like a celebrity. This is fantastic. Thank you.
Well, doctor, you are a celebrity. Everybody around the world watching you today. I mean, that's some celebrity enough.
That is amazing. 256,000 subscribers, Dr. Cooley. That is crazy.
That's one platform.
On one platform.
We're on 84.
Amazing. Thank you for this opportunity. Thank you so much.
First of all, I want to thank you. I mean, Dr. Michael Mantell as extraordinary. And I was serious about the guests that he brings on the show.
Wow.
He uplifts the show tenfold. Actually, he put us on the map on Tuesday because everybody's watching it, and it's so great that we have the radio station locked in on our Tuesday show. So, Dr. Cutler, can you tell our viewers and listeners a little bit more about you, where you grew up, what makes you click, why are you so passionate about what you're doing?
Wow. Wow. Well, we're going right back all the way to the origin, you know? And I guess I live in Rhode Island. I've been in Rhode Island for a long time, since 1981, 44 years. It's really become home. I did my high school, undergrad, med school, all in Rhode Island. For a while, as a young adult, I felt like, hey, I need to get away. Like any young adult, I need to go to the big city, New York, DC, San Francisco, San Diego. Somehow it never happened. I did get to visit all those places, but I've never been able to live there. And as luck or fate or the universe would have it, the best opportunities and professionally and personally have always just been in Rhode Island or surrounding Massachusetts. So I've been here for a long time, and now having gotten married in 2001 and settled, I feel like, wow, this is amazing. Rhode Island, what a beautiful place to be. It's a great place to raise a family. It's a great place to have a multi-generational connection to. I feel blessed that my parents were the original immigrants and they brought me here. And because of them and their lasting, ongoing legacy, I feel very much welcomed and a really important part of the Rhode Island community. So, it's one of those things where you kind of live through the circle of life long enough, and if you're patient enough, I guess you start to realize, how bountiful the universe is.
And see, by that answer alone, our audience already knows what I've been saying to James and to Michelle Cooley, that
Um,
you are just the easiest going, most natural, authentic guest. I love
oh,
having you on. It's great.
thank
So
you.
I have a
Oh,
question.
thank you, Michael.
Anyone else in your family physicians? Whoops, let me get rid of that. Anyone else in your family physicians?
No, actually, that's an important part of the origin story too. So way back when I was in high school, back in the 80s, as a good Indian kid, having relatively recently come from India, there weren't a lot of pathways out of a middle class lifestyle. It was really either medicine or engineering. And my dad was an engineer. We had other people in the family who were engineers, but there were no doctors. So, when I came to making a decision about career at age 17, I said, well, let me try out this medicine thing. That's literally all it was. Can you imagine getting into medical school today, Michael, on that
Oh my goodness.
basis? But that's the way it was for me. I said, let me try it out, and luck would have it. It worked out. I got into an 8-year medical program at Brown
Oh,
and just wound up kind of going down the pathway. At that point, I really didn't really know what and why I was doing it, other than what you just asked, engineering or medicine. And I just flipped the coin, and I said, let's go with medicine because it's something new. But as I kind of get deeper into the 8-year medical journey, I was fortunate that I was at what we call the program in liberal medical education. So it encouraged me to open up my aperture a little bit. Instead of being just a hardcore math science kid, just kind of sticking close to what I knew already, I was able to explore areas in religious studies, in persuasion, and particularly in community health and public health. And that's where my passion really grew, to the point where I decided to take a year off between my third and fourth year of medical school and do a master's in public health. And
wow.
once I did that degree, that was like lights out. It was just like being turned on from the inside. I was like,
Yeah.
whoa, I had no idea that there was this option out there. How can I get more of this? So that's kind of really, I think, the question that Dr. Cooley asked and that you followed up on is the real true origin story. So I'm glad you followed up on it.
Yeah, yeah, yeah. It's interesting. When I told my parents I wanted to be a psychologist, they said, "What is a psychologist? Can you make a living from that?" There's no psychologist in my background. My mother was a
Seriously.
brilliant psychologist in her own way, not
Uh-huh.
formal, but boy, oh boy, did she, before there was anything called rational emotive behavioral therapy, she,
Wow.
but so you are steeped, you have a deep background in clinical medicine and so many other things, um, uh, public health, systemic leadership. In your view, we call our show 360-degree health, the very reason that you will understand. In your view, what does 360-degree health truly encompass, and why is traditional purely clinical medicine, that model, insufficient for achieving 360-degree health.
Oh my goodness.
Hey,
What a
Doc,
question.
can you
Yes.
hold that thought for
Yes.
till after the break?
Yes.
Can you hold that thought till after the break, because I don't want to get started and we break up and
Sure.
and so I tell you what, as you already know, this discussion that we're having with Dr. Gupta, of course, my main man, Dr. Michael Mantell, extraordinarily already leading in that direction, because loving organization, loving people, and all those things are so important. So I tell you, you want to be part of this conversation, all you have to do is just go to the platform that you're watching us on, ask any questions that you might have in the comments portion of it, or pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. It's your life, and with the show left and break.
That's right. It's Dr. James, JC. Let's go. It's the James Cooley Show. It's your life. Dr. James JC Cooley. All right.
Looking to advance your education or career while staying true to your Christian faith? At Viridian Christian University, we make higher education affordable, flexible, and accessible wherever you are, cultivating a vibrant learning community where faith and knowledge converge, preparing graduates to fulfill their life's purpose. Whether you're pursuing a bachelor's, master's, doctorate, or honorary degree, Viridian's 100% online programs can fit your lifestyle. Study on your schedule from your home, office, or anywhere without compromising quality or values. With affordable tuition and programs in Christian leadership, business, and theology, Viridian will equip you to lead with purpose in a changing world. Go to ViridianChristianUniversity.com and see how you can join our global fellowship of faith-driven leaders, online and affordable. To learn more and apply, visit ViridianChristianUniversity.com. Viridian Christian University, a unique and dynamic environment for success, empowering leaders of faith.
I'm Dr. Michelle Cooley, heart disease research. Hi, I'm Dr. Michelle Cooley. Heart disease research saves lives. It's that simple. Thanks to medical advancements funded by the American Heart Association, more women are surviving heart attacks, strokes, and other cardiovascular diseases than ever before. But there's still so much work to do.
Hi, I'm Dr. James J.C. Cooley, and I'm raising funds to support life-saving research, because every heartbeat is worth fighting for. In honor of Women's History Month, please join me in support of the American Heart Association and women's health. Hello. Welcome back to the James Cooley Show. It's your life, and I tell you what, just to remind you that you already know it's Tuesday, and the link is what you think. We're gonna get to that one later, but not right now. But the honorable, the main man, Dr. Michael Mantell, has done it again. I salute him right now, and I'm gonna get a chance to salute him for another 2 segments after this. And we are having this sit down discussion with Dr. Gupta, and what we're talking about is the loving organizations, how all of those things fit in. Now, before we go to the re-ask question, Dr. Michael Mantell, I want to ask Dr. Gupta, could you define what is meant by a loving organization and why you chose that topic to talk about today?
Oh yeah, that's a really great question, Dr. Cooley. Appreciate that. It just it's the kind of journey of life. This is a term that just hit us a couple of years ago. A few small number of us were looking at the healthcare industry, and we were really troubled about what was going on in the industry in terms of a high degrees of burnout and turnover. This was all going on at the time of COVID. It really troubled us because, we were just doing our thing. I was a performance improvement consultant, culture transformation consultant. I thought I was doing great work. But then when COVID came and the burnout rates were just going through the roof, it really was a wake up call for me. And it started scratching my head thinking somebody must have figured out how to do things better and differently. And that's when we somehow chanced upon it was really a discovery or exploration. We were looking for people who had figured out how to do things differently. And we came upon a group of 3 or 4 individual organizations that just seemed to be taking better care of their own people. And by doing so, their people were reporting more meaning and purpose and joy in the work, and therefore more likely to want to be engaged in the work and more willing to be collaborative. And that was leading to amazing outcomes across the board. So in healthcare, we look for better quality, better safety, better patient experience. And they were also delivering greater profitability, all not at the expense of their people. So their burnout was going down, turnover was going down. So this is the quintuple aim that I talk about that we're all often been searching for, very elusive to find, but they were hitting it out of the park on all the metrics. And as soon as my colleague and I, Dr. Tom Dahlberg and I, we were working on it together, saw that, we said, this is what love feels like if it was inside an organization. So we called it a loving organization. That's just kind of what appeared in our heads and from where it came. Again, the universe gifting this to us and giving us the chance to observe these amazing organizations in practice. So we coined that terminology. We took that terminology back to these exemplar organizations themselves, and we said, listen, this thing that you guys are doing seems to be really special. We feel like this needs to be studied and emulated and spread. We're calling it a loving organization just to put some kind of a label on it. And they all stepped back and said, whoa, what is that? We've never heard of that term. This is amazing. We had no idea other people were out there doing anything like this. We were just sort of doing our own thing. We had no playbook for it. We were just kind of dedicated to what we would have called a culture of excellence or a culture of caring. Maybe a couple of them might have called it living and leading with love or something around love, but it wasn't uniform. Again, it's just what struck us. They said, nevertheless, what you're talking about is exactly what we're about. We love this. We want to work with you. We want to support you. Tell us, what you're planning to do with this so we can get behind you. And that's when we as consultants kind of were like, wow, this is amazing. We're just studying them. We didn't help to contribute to what they were doing. We were just kind of observing and connecting the dots and maybe putting some labeling around it. And the organizations themselves that were doing the great work were saying, this is fantastic. So we knew we were onto something there. And that's kind of where the name came from. The idea of love, kind of just sprung out from the activities that they were engaged in. And from there, it's only continued to grow.
Is Hackensack Hospital in New Jersey one of the
Yes.
yeah, I just had some experience with them, and it's
Ah.
palpable. You
Oh,
feel it the moment you pull into the parking lot. From end to end, that level of care, love is amazing. I was going to ask you a little bit
wow.
about why traditional medicine, purely clinical, is insufficient, but I think you've addressed that. Let me move on. So we talk about love and we talk about caring. Can you give us a very specific example of maybe a specific policy change or a system redesign that you champion based on a loving organization principle that directly
Yes.
improved clinical outcomes, readmission rates, or patient
Yeah.
safety, or something like that? Any specific example?
Yeah, happy to. And Michael, if you don't mind, maybe I'll take a half step back also just to help orient folks, because I don't think in my previous answer I conveyed enough that the whole loving organization movement and the work that these exemplars are doing is based on systems. So it's not just about saying, Dr. Mantell, you need to be more loving. Dr. Cooley, you need to be more loving. Why don't you take some empathy classes? Why don't you take some compassion courses? Or we can offer you a whole host of well-being courses, yoga, meditation, mindfulness. All of those things are actually really great and very powerful. I've experienced some of them myself. I'm sure many of our audience members have. So they're very powerful. So there's nothing to put down about any of that. It's just to say that that's not sufficient and we shouldn't stop there. That's maybe where we have to begin. Offer all these resources to individuals so they can improve their own state of resilience and well-being and lovingness and compassion, but also recognize that the organization has a role in this, right? With 50% of people burning out across multiple disciplines, across multiple organizations, is not because 50% of people have individual deficits. It's because we, as an overall system, haven't recognized how to create an environment that's supportive of love and compassion. So that's where the systems piece comes in that Dr. Mantell, you're asking me about. We have devised a model we call Integrate. It's a mnemonic for 9 systems that are in every organization. There's 4 people-based systems. That's leadership, teams, communities, and then the staff themselves. And then there's 5 process-based systems, which is management, culture, technology, workflows, and policies. When you put all of those together and stack them together, those are all the subsystems of any organization. Our hypothesis and what we've seen and observed from our loving organization exemplars is in the default state, when those subsystems are operated with fear, then you get more fear as an outcome. So that gets represented in healthcare as burnout, disengagement, loneliness. It's not only in healthcare, it's in almost all of our organizations, and it's rampant throughout society. It's mostly because we're not aware of the systems, and we're not aware that in the default state, we're managing through fear. Top-down, command and control, authoritarian type mechanisms are all fear-based, and we've just inculcated these throughout our lives, throughout, decades, millennia, you name it. It's age old, so it's not a new problem. Again, the hypothesis is that when you operate these systems with love and you create loving policies, loving technology, loving management, loving leadership, then you get love as an outcome, which is where meaning and purpose and thriving and all come in. So I just wanted to give the audience a little bit more of that flavor before I answered your
Give
question.
us a
Yes.
specific example of, let's say, a loving policy. Like someone
Yes.
comes into a medical organization, how do they
Yes.
feel whether this organization has a loving policy? What does that mean?
Yeah, it's
Practically.
probably how you sense things at Hackensack Meridian Health. It's not that it's dependent on one superhuman nurse or greeter or doctor to make you feel that way. It's not a chance encounter. These are systems that have been created by the hospital to ensure that the staff feel supported in this effort. They may be busy, they may be overworked, they may have a long, queue waiting for them. I'm not sure in what setting you encounter them, but let's say in the emergency room, they may have a lot of people waiting. So now you have to have a policy that actually supports the frontline registration agent or the nurse to be able to go maybe into the waiting room and greet people, to be able to ask them, how are they doing? To be able to say, hey, I'm sorry it's taken so long. I know you're frustrated. I know you're not feeling well and you want to get in the back. Let me reassure you that we're doing the best we can. Now, all of those things should not be incumbent upon one superhuman nurse or doctor or greeter to be able to figure it out. Those are the kinds of things that we think need to be embedded into a structure of the organization. That would be a policy or a protocol or a workflow, you could call it, some mechanism by which we say, this is the way we're going to do it at, let's say, Hackensack Meridian Health. This is how we're going to treat our patients. We're going to train each other on this. We're going to have a formal policy that supports it. We're going to review that policy and amend it as needed. Maybe there's an opportunity that we still haven't thought about. So the policy doesn't become a dead document. It's actually a living a force. So hopefully that's an example, Michael, of the idea you have in mind. It's basically about thinking about how are the policies that we have created, how are they designed not only to prevent risk and prevent malpractice and to create standards and to kind of keep us on the straight and narrow, but how are they actually helping us deliver the patient care and the love that we would like to deliver?
So you have driven very successful transformational efforts. I'm curious, what is the single biggest barrier to successful, sustainable change in large healthcare systems? What have you run into? What's the pushback?
Well, I think once I mean, I guess there's pushback at different levels. Pushback in terms of even getting into an organization. They may think, well, we've already done this, we've already tried it, we're too busy, we don't have the time. This sounds great, but we are overwhelmed. We don't have the money, to go after this. So there's a whole range of barriers that come up before you even get into an organization. And unfortunately, the challenge is it's like a catch-22. Those are the organizations that probably need the help the most because they're drowning, but they can't, come up enough for air to see that they're going to have to try a different approach. They're going to have to take a more holistic approach. They cannot just keep it demanding more from their people. So there really isn't any more time to give. But instead of asking them to do something differently, or something more, we're asking them to take a different perspective and a different approach on the same work. So we're actually trying to reduce the burden and free up their time. But unfortunately, it takes some work to help organizations understand how they're going to get there.
Wow. And you know what? It take work, and hopefully a lot of them are locked in on this because this is work, meaning that we're going to help your organizations out. We're going to help reduce doctor burnout. We're going to help ease a lot of things. And that's what this conversation is about today. So I tell you what, we're going to take a station break. We're going to come back. We got a lot more of Dr. Gupta and Dr. Michael Mantell. And if you want to be part of this great conversation, just pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. It's your life, and we'll see you shortly after the break.
Doctor J. Y'all ready for the Doctor James JC Cooley. The James Cooley Show. It's your life.
You with an engaging James about his arrival in a
really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, or hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? In everything that you do.
Mantell and a roadmap to achieving the American dream. This is a must listen for anyone who thinks they're stuck in life or needs to understand that their current situation is not their final destination. Country Boy, City Boy, a journey that ain't over yet, is the unfiltered truth to provide hope for the future by challenging you to refuse to become a victim of life's circumstance and dare to become an overcomer, because a bigger, better, and more impactful life awaits you. Get the new audio version of his book, Country Boy, City Boy, A Journey That Ain't Over Yet, by Dr. James Cooley, on Amazon or wherever books are sold.
Check it out. Check it out. Your life with Dr.
Hello. Welcome back to the James Cooley Show. It's your life. And I tell you, Dr. Mike, I'm so impressed with this guest right now. I just have to do it. I have to do it now, Doc. You know what I'm getting ready to do.
I do know.
I have to do it now. Dr. Gupta, I don't know if your schedule going to allow you to come back on for part 2 or not. But normally, we don't extend this to everybody. I mean, but if your schedule permits, Dr. Michael Mantell and I would love to have you back on. Not that we still got some work to do in this one, but
Wow.
love to have you back on for part 2.
Oh my God, that's amazing. That feels amazing. Thank you for extending that honor. Even though we're not even done yet, I appreciate that.
No,
I'm
I
looking
just
forward
I
to
just
the
absolutely
energy.
pleasure in my heart right now.
Oh, thank you so much. Yes.
One of the things I want to talk about right now, I mean, right before we get back to Dr. Gupta, I want to talk about this amazing book by this amazing doctor. And it's part of the show that we do every Tuesday. It's called The Link is What You Think. The link is what you think. And I'm not going to give anything away, but I tell you what, if our mindset is not right and we thinking all crazy like that, it's going to link us to a lot of different things don't make any sense. And it's going to cause us to many times to go down the wrong path. I wrote a book called My Path a few years back, and it never revealed to me until I got with Dr. Michael Mantell, and we start talking about the link is what you think. So with that intro, Dr. Michael Mantell, I'm turned over to you.
There it is. There's the book. The link is what you think. So that's the point. We're going to share this right now. And every week I come on and I open to another page. Say it's just random 184. Who's in charge of your feelings? I wrote this book. I also wrote the original Don't Sweat the Small Stuff to help you live better and to disturb yourself less. Let me share 5 points from this book on page 184. Who's in charge of your feelings? Yes, the world is full of suffering, but have you noticed that it's also full of surmounting? 2, do you really realize that all of your emotions originate solely in your thinking? What the heck are you busy blaming anyone else for? 3, you'll never fully be free until you no longer ruminate over things you can't control, like most things in your life. Everyone has illusions that they believe are the truth. But dogmatic thinking and demanding, insisting, and expecting are really the greatest obstacle to feeling happy. And number 5, you know who your real boss is? It's that mental attitude that you cling to. So that's the point. Remember, the real link is what you think. And if these 5 points sparked even one little thought to live life better, then mission accomplished. I want you to be kinder to yourself. And remember, until next time, stay curious. Don't sweat the small stuff, because your next mindset shift is just a thought away. So, okay, so I want to come back to Dr. Gupta. And now, Dr. Cooley, you know that Dr. Gupta has been involved in Trustworthy Technology and the Innovation Consortium. He has been a leader in this field. And I want to know a little bit about AI in healthcare, because, AI gets a bad name, it gets a good name, I want to hear your thoughts, Apurv. How can healthcare systems that you are consulting with implement technologies like empathetic automation or AI while ensuring they don't dehumanize the 360-degree patient experience or erode the compassionate culture that you're building with a loving organization?
Yeah, Michael, thank you for bringing that up. I mean, I guess there's no conversation that can be complete these days without talking about AI because it's ubiquitous, right? And I think it starts with, if you recall earlier in the conversation, we were talking about integrate, the 9-letter acronym that stands for all the subsystems. Well, one of those is for technology. Right. And so we recognize that technology is a critical system in creating a loving organization. It just has to be managed with love and not with fear. The challenge with a lot of technology, and even before we get to AI, we can see that. We can see it in all the technology we have available, cell phones and social media. We were just talking about it over Thanksgiving with the kids, and people were posting about and have been posting about it on LinkedIn that there's lots of challenges with technology. It just kind of depends on how you approach and how you design that technology, how you leverage that technology. Is the technology using you and consuming you, and you've now become, the product, or are you somehow leveraging the technology to learn, to grow, to love, to connect? Technology itself has all of those capabilities. Which of those capabilities gets unleashed is partly based on the design of it, which is what we call the loving intent that goes into the design of the technology, guardrails, governance, standards. All of those elements have to be baked into the technology, that people have to be looking at the use of the technology in a organizational context. It's usually a governance committee that would be comprised of executives, technologists, clinicians, nurses, doctors, all looking at, all right, now we've deployed this technology or this AI piece, how is it actually working? Is it delivering the results we want? But we need to be doing that same thing in our society, in our families. I mean, what's the governance supervisory function that we all have in relating to each other, in making sure that we're using the technology wisely and we're not just getting addicted to it. And now it's, in doom scrolling and now spending lots of hours and ultimately getting more and more lonely as a consequence of it. So the same things that we all notice, that many of our audience members will notice that happen to us on a personal level, are just amplified in an organizational context. That hopefully is helpful in us understanding what needs to be done. So again, start with loving intent, program that into the technology, make sure that there's humans still involved when it comes to AI, that are in the loop, as we call them, that are looking at each and every aspect of the technology piece, and that that we have a feedback loop designed. We're looking at the data. That feedback is then being fed back into the governance process, so we can constantly be evolving. There has to be learning mechanisms that are involved. The other side of it that we don't often think about is that AI could be this incredible tool for efficiency and productivity, which is amazing. Many of us are already starting to see it. But that's also where a lot of the fear comes in. That if it's so efficient and productive, then what's going to happen to me? What's going to happen to my job? Am I going to be out of a job? Or am I just going to be expected to work harder, see even more patients as a doctor, to carry even more patients as a nurse? So this fear factor that comes in with the use of technology when we don't have enough confidence that we have the necessary safeguards built in, that we don't have loving intention built in. One of the outputs of a carefully designed AI system would not only be productivity and efficiency. Those are good things, and we do want them because the costs of care are so high and unsustainable. Workforce burden is very high, and we just don't have enough doctors and nurses to go around. So it would be amazing to have technology that can make all of this accessible. But I think we also need to remember the human dimension and make sure that that's also being prioritized. How are we making sure that in addition to the workload and efficiency and productivity, that we're also prioritizing humanity, compassion, and ethics? So as long as we keep those things relatively balanced in the design, we're going to get great outcomes. There's nothing evil about technology, and we've all had, we can use lots of examples over decades and millennia again, about various technologies that have come out that could potentially have changed human life. Many of them have had good uses and others have had nefarious uses. So how do we make sure that we continue to put that technology to positive use?
Wow. just listen to how you explain that. What are some of the biggest challenges that you're facing and implementing and making sure that organizations truly understand, especially with the rate of burnout,
Mhm.
how we, what are the biggest challenges that you get back or feedback that's saying, Doc, this is so hard. We don't have the
Yes.
resources, we don't have the fund, we don't have none of these things. Yeah, but we want to follow what you all are doing. Can you talk about that a little bit?
Yeah. Sure. Yeah, Dr. Cooley. It's I'm tempted to answer it for both technology and loving organization, but I'll start with the latter because I think your question may have had a broader intent. I think, honestly, the biggest challenge is something that I've already seen you advocate actively, is that people misunderstand love. They think love is just a feeling. They think that love is about just being nice and respectful and kind. And therefore, they feel that love is not going to be sufficient to create results, that it's not sufficient to lead to excellence, and that it's not sufficient to hold people accountable. And so they think that if we are too loving, then we're simply going to be too accommodating, and therefore we're actually not going to be able to meet the needs of the organization. So I think that's actually, unfortunately, our biggest barrier, is the way in which we talk about love as a society, and through all our wisdom traditions, through churches, and through our religious homes. I think that what we haven't been able to communicate is that love can also be tough love. Love can also hold people accountable. Love can be mutual accountability. Love can be clarity. Love isn't just about harmonization and feeling good. Love is about systems, and love is about infusing our human intention into the systems so that they can support the people. That's the part I feel that most people don't really get. We sort of understand love because it's an often used term. Probably we'll hear it 10 times a day. But do we really understand how to leverage it within this context of helping organizations to become more loving? Therefore, that can help decrease the burden on the individuals.
Wow, that's absolutely fantastic answer. We got to take a quick break right now, but want to get back. I love the terminology, how you put that in love, because it's all about that. Tell you what, you want to be part of this great conversation, all you have to do is go to the platforms you're watching us on. Ask any questions that you might have. I promise you we'll get you an answer. It's your life. And we'll see you shortly after the break.
At Viridian Christian University, we believe education way to a purpose-driven.
It's the James Cooley Show. It's your life. Dr. James J.C. Cooley. Yeah. Come on.
VCU, bachelor's, master's, doctorate degrees.
challenges of tomorrow, and we rely heavily on the generosity of individuals and business owners for support. Without the assistance of community-minded individuals just like you, we wouldn't be able to serve our youth each year. We ask that you make a commitment to support our annual appeal by making a cash donation. This year's goal is $50,000. Your generosity will assist us in making a difference in the lives of the youth in our community. You can give online at CooleyFoundation.org. Remember that every donation makes a difference regardless of size. The J.C. Cooley Foundation thanks you in advance for your contribution.
There's much truth in a journey that ain't over yet, as all of us journey through life's precious gift of time, just like I have. Hi, I'm Todd Pierick, the producer of The James Cooley Show. It's your life. And in the new audio version of his book, Country Boy, City Boy, A Journey That Ain't Over Yet, you can join James as he shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. This is a must listen for anyone who thinks they're stuck in life or needs to understand that their current situation is not their final destination. Country Boy, City Boy, A Journey That Ain't Over Yet is the unfiltered truth to provide hope for the future by challenging you to refuse to become a victim of life's circumstance and dare to become an overcomer, because a bigger, better, and more impactful life awaits you. Get the new audio version of his book, Country Boy, City Boy, A Journey That Ain't Over Yet by Dr. James Cooley on Amazon or wherever books are sold.
Check it out, check it out. Your life with Dr.
Hello. Welcome back to the James Cooley Show. It's your life, and I am thoroughly enjoying this discussion. And we only got about 7 minutes left in the show, but we don't get back to. But one of the things I want to talk about, everybody say, "Hey, what's this king stuff that keep popping up?" And are you a king? Yes, I am. Over in Ghana, and I am proud to say that I will be heading back to my kingdom in February, and I will be bringing with me the new queen, who will be crowned queen. And just a lot more information going to come out on that one. But I get this. Oh, I see your commercials, and what is this? I don't talk about it that much in the United States, but we will. And so I tell you what, everybody's invited. More information is to come. Dr. Michael Mantell, we've got about 6 minutes left in the show.
Okay.
I'm gonna turn it back over to you. Let's get as much out of
You
Dr.
bet.
Gupta as we can.
So real quickly, we've been talking about empowering healthcare systems, empowering doctors. Real quickly, how I want to empower patients. What do you wish every patient knew before walking into a doctor's office? And I'm going to follow up with another question. So we have about 5 minutes left. So what do you want every patient to know before they walk into a doctor's office?
Well, I think I'll keep it short, Michael, because you said there's another one coming. I think the best thing a patient can do is to be an advocate. Unfortunately, what we find is a lot of patients are still feeling like it's a hierarchical doctor-patient relationship, and they just have to listen to the doctor and be polite, and it's rude to ask questions. Now, we don't want to create an adversarial relationship, and a lot of doctors have talked about that, where they feel like patients are coming in already armed with a mountain of information and kind of challenging them. So we're not trying to push the system to that point. That's, again, not loving. Loving is somewhere in the middle. It's not just agreeing and being nice and being polite. It's about actually talking, communicating, asking the questions that are in your mind, but being an active part of the journey. You can't get 360 health if you're not actually, an active participant. And by the same token, I would say bring a family member with you so they can also be a part of the journey, so that you have another advocate on your side. Hopefully your patient, your physician is an advocate for you. You're an advocate for yourself. Your family members there as an advocate. Now we can really accomplish something together.
And many patients bring ChatGPT with them as well. Okay, now real quickly. So looking 5 to 10 years ahead, what do you think is the most radical yet achievable shift that you foresee in our healthcare delivery model that's going to bring us closer to this notion of a loving 360-degree health model?
Well, I think, Michael, that question probably begs the previous question, right? It's if you think 360 health, 360 degrees is a circle. And so then the question is, what are you putting the circle around? And right now, I think we put the circle around the system and the needs of the system. And we put the circle around the physician. That's kind of just, historically, we put a lot of emphasis on the expertise that the system brings. And everybody has to go to the physician and to the system for their care. We're already starting to see it shift with technology, with telemedicine, with ChatGPT. We're starting to see more access and more independence and kind of more, technology that's going to the patient. I think that's what is really going to happen.
Like
More and more of that's going to have to happen.
like the technology that we were on our watch. It's going to read
Yes.
everything and send everything to our physician, and the physician's
Yes.
going to know everything about us before we even get there.
Yes, exactly. And I think that's going to be amazing. Again, it could be daunting, but imagine if you had a ChatGPT, biofeedback, everything was being fed into the ChatGPT. It was helping you analyze what was going on. Now you're the captain of the ship. You
Yeah,
decide when you want to pull in resources towards you rather than the resources are directing you and saying, come back and see me in 3 months, or you need to go get this procedure. So I think that that's a radical shift, the patient being the captain of the ship, which is starting to happen. So I think it's doable. But in order to make that happen, really have to drive this message home through this kind of a programming that, patients need to think of themselves as more active
yeah.
agents of their health, and there's 360 health rather than just consumers of it.
Apurv, if people want to get in touch with you or learn more about a loving organization, how can they get in touch with you and learn more?
Yes, thank you for asking. Really appreciate that. We have a brand new website. It's amazing. Please check it out. It's called www.alovingorganization.org. You can become a member if you're so inspired. You can donate. We would love that. Any and all kinds of donations welcome. We're getting a lot of traction and momentum. You can check out all the stories, the case studies. What is a loving organization? Please do check it out. And if you want to be in touch with me, just put an Apurv at the beginning, APURV at alovingorganization.org. Thank you so much, Michael, for this opportunity. Thank you, Dr. Cooley. I can't believe this opportunity. One thing I was going to say that I didn't get to say, but I have to say, is that we didn't just get to talk, we got to dance. That was so much fun. That was so much fun. I love that. Thank you for the energy, and thank you for this opportunity.
I want to extend that opportunity to you again if your schedule permits. Yeah, so if it does, please let Dr. Mike Mantell know, and we would love to get you back on because this is certainly a follow up, and also to expand our viewers' knowledge on some of the things that you all are doing or that's going to be coming up. So thank you so much, Dr. Gupta.
That would be
Dr.
my
Mike
pleasure.
Mantell, you already know you're the man.
My
Thank
pleasure
you.
every
Thank you
week.
for your
Thank you
program.
so much.
I'd like to thank Dr. Michelle Cooley for putting together another absolutely outstanding program. Most importantly, I'd like to thank my producers in San Diego and also in Dallas. Toddy, you are the man. Toddy, the water is what I call him. Most importantly, I'd like to thank our viewers and our listeners for tuning in to the James Cooley Show, Monday through Friday, 2 p.m. Pacific Standard Time, 4 p.m. Central Standard Time, 5 p.m. Eastern Standard Time, and also every Sunday on KCBQ, The Answer, AM 1170 out of San Diego, and KSCA, AM 660, The Answer out of Dallas, Fort Worth. Always, always, always dream big, think big, and be big at everything you do. We'll be back tomorrow. Same time, same place. It's your life, and we'll see you then.
Dr. James, JC, Cooley. It's the James Cooley Show. It's your life.
And that's how we do it.
Awesome.
That's how we do it. Apurv, you're great. Your answers were
Uh,
so rich and so deep and so
oh, goodness.
accessible. Just
Thank
great. I love it.
you.
Thank
Thank you so much. Really, honestly, that means so much,
you.
Michael.
JC,
Really
you're,
appreciate it.
JC, you're muted. You're muted. Your mic is off.
I don't
There you
know if
are.
the outro
Yeah,
went out.
we hear you now.
I don't know if the outro went out the right way.
Oh,
But
really?
that's okay. We'll be okay. You
You
know,
can continue.
hey, this was absolutely fantastic. Absolutely fantastic. We got to do it again.
Absolutely. I would love to. Actually, I was thinking we didn't get into this, but your Viridian Christian University is probably a loving organization, just based on how you describe it. We actually have a client right now, and I can name it because we're not on the air, correct?
No,
Yes,
we're
we're
not.
not on there.
So we have a client. Our first paying client actually is Seton Hall University, which is a Catholic university in New Jersey, and
What's
they
the name?
already Seton Hall. It's
Oh,
called Seton Hall.
I know.
Yeah, it's
Yeah,
a pretty well known Catholic university
Very close.
in
Where
New
my son
Jersey.
lives.
Yeah,
very, very,
exactly.
very familiar with Seton Hall.
Yeah,
It,
so they would like to integrate these whole loving organization principles into their curriculum to train their students, their clinicians, their faculty, their preceptors in being loving, leaders, loving, helping to create loving systems. I would love to understand from your perspective, JC, how do you think that Viridian, Christian University, I mean, it just sounds like it. I just saw the ads, but it
w-
just
w-
sounds like from the messaging that this is something that would be very resonant with you and with the university. So to me, I would love to have a chance to explore some of the education side of things that we didn't get into today. We talked a little bit more about healthcare, or we could even have a separate private conversation around what, does this concept, do you think it would be appealing to a Viridian Christian University?
I would love. I don't know if you knew I'm the chancellor of that university.
I saw that in the ad. Yes, I said, "Whoa, this is amazing!" And I mean, faith-based curriculum. This is exactly what it's about. And with the faith, you already believe in Jesus Christ's love. What we're finding at Seton Hall, I don't know if it's the case for you, but in general, we find with a lot of faith-based organizations in healthcare and in education, is they believe in the love, but they just don't know how to operationalize it and put it
Right.
into systems.
Right.
And so that could be, you may already be loving, but on the road to being more loving, there could be opportunities to say, hey, let's look at all the systems. Let's look at the technology. Let's look at the policies. Let's look at the workflows. Let's think, how are we really, making our students feel loved, not by expecting them to be more loving or the faculty to be more loving, but by engineering it into the systems of the organization. So I think that would be a fantastic conversation.
What I would like to do, if it's okay with you, is turn your information over to the founders.
Oh, that would be awesome.
They will
Yes.
reach out to you in a heartbeat and chat with
Beautiful.
you. And just
Beautiful.
because we're always trying to build our university, make it a world class
Awesome.
organization. Whatever we have to do with our faculty, I mean, a lot of things I learned today. But if it's okay, can I
Oh, please. Yes.
send your information to the founders of the university? I promise you, they'll reach out and they'll discuss any information that you might have. They'll be more than happy to discuss that with you because they're gonna want to figure out exactly what you are doing as well.
Wonderful.
So
Wonderful. Thank
if
you.
I can do that, I think Michelle got your information. I'm not sure.
Yes,
Oh, absolutely.
absolutely. Absolutely. And that might be a conversation, Michael, that you and I have together with
Sure.
them, because I know you're really interested in this. So,
Oh, yeah.
and we've been talking about how we can partner together as well. I would love to have that conversation. I think it would be
I
very
would love to pass that information to them,
Mhm.
and they would certainly invite the people that you recommend, especially Dr. Mike Mantell. You already know.
Yes.
But this, then Dr. Mike, you'll get a chance to know a little bit more about Meridian Christian University.
Oh, I've been reading about it.
Yeah.
I understand it, and I never connected Seton Hall to that. Our son lives 2 minutes from Seton Hall, right near Philly Dickinson. That's how I
Yes.
happens at Meridian. But
Yeah, these are big opportunities, because the thing is, we talk about burnout in healthcare, but guess what?
yes,
Burnout is in education. Burnout is in society. Burnout is in our communities. Burnout is everywhere. So even our students are burning out, and our faculty are burning out. So it's kind of the same challenges which we need to address. And there's no real boundaries to it. We put an organizational boundary around it only because the organization can do something about it. It has a meaning and a purpose. But otherwise, the issues that we're talking about are really societal issues. The good news is that we can solve them with this approach. So again, this would be quite an honor to have that conversation with both of you.
Dr. Gupta, I give you my word, I make it happen.
Yes,
He will.
thank you. Thank you. Thank you.
Look,
Thank you.
have a
Thank you.
good rest of the week, sir.
Thank
Good
you
to
so
talk to
much.
you. And we're going to be doing Kevin MD soon.
Yes,
Down in
indeed.
Pacific. And
Indeed.
this has been great. Thank you so much. I'm
Thank
going to run.
you.
Hey,
Thank
this
you
is
so much.
fantastic. And my piece will be reaching out to both of you guys real soon in regards to Viridian Christian University.
Wonderful.
Thank you very much,
That's
JC.
another
Thank you.
hat I had to put
All
up.
the best. All the best. Take care now. We go out with a dance.
well.
Do we get an outro with a dance?
Oh
or
yeah.
no?
Oh yeah.
So much energy. So much energy. I love it. Thank you, Dr. Cooley. Thank
Hey,
you so much.
thanks so much, Doc.
All the
Dr.
best. All the best. Bye-bye now.